My name is Dr. Jace Bullard. I am a new hip and knee replacement specialist here at Benefis Hospital, and very excited to have this opportunity to answer some questions about hip and knee replacements. By way of background, I come from Utah originally. I did my undergraduate studies at Brigham Young University, and then went to Case Western University in Cleveland, Ohio for my medical education. I then spent 5 years at the University of Michigan in Ann Arbor, Michigan for my orthopedic surgery residency, and then did 1 year of subspecialty training in hip and knee replacement in Reno, Nevada. So again, very excited to be here and to have this opportunity to answer some questions. Steroid injections can be very effective for both hip and knee arthritis. I would say in general that patients experience more relief with injections for their knee arthritis than for hips. If you've had multiple hip injections and they seem to be becoming less and less effective, I would probably recommend that you stop getting the injections in the hip. Anti-inflammatories, whether over the counter or whether prescribed by your physician, can be just as effective and don't have the risks and the obvious unpleasantries of having an injection in the hip. We expect that injections become less and less effective over time, especially in the hip. And so by staying active, by taking oral anti-inflammatories, you can experience some of the same symptom relief. It's very common for patients to complain about worsening symptoms with changes in the weather. Sometimes it's when the temperature gets cooler, and it may even be when it's getting warmer or there's a storm coming through. We don't exactly understand all the reasons why this happens, but it is a very common complaint. Worsening symptoms of achiness or the sensation that you need to get up and stretch can be pretty indicative of early arthritis in the hip. And if you're having these issues predictably when the temperature changes, I think it is probably time to come in and to have some x-rays and to see exactly what's going on in the joint. Hip pain can present in a multitude of ways. Most commonly, hip pain is actually experienced more in the groin. It tends to be sharp and achy in nature, worse with any kind of range of motion. Patients tend to have a hard time putting on their own socks and shoes or rising to get up and out of a car. Sometimes patients can present with sort of atypical pain that is originating in the hip, but it's felt in other places. For example, radiating down towards the knee or radiating to the outside of the hip. Those can be symptoms that are actually representing hip joint pathology. There are other reasons for pain in these areas though as well, like problems in your lower back or problems in your knee. And so part of our job is to make sure that symptoms that you're having are in fact coming from the hip and not coming from other places in the back or lower extremity. Hip and knee replacement in general are very effective surgeries. They do have risks. One of those risks is infection. And while it only occurs about 1 to 2% of the time, the consequences of an infection in a hip or knee replacement can be fairly devastating. And so we do our very best to mitigate the risk of an infection. We give preoperative antibiotics, and we try to control the things that we control to make your risks lower. Things like obesity, diabetes, other medical problems can contribute to a patient's risk for an infection. And so before your surgery, we do everything we can to optimize you to bring that risk down. There are multiple reasons why patients may experience hip or knee arthritis at an earlier age. With modern materials, we're expecting hip and knee replacements to last 20, 25, even 30 years. So whereas in the past, age was more of an issue because hip and knee replacements wore out earlier, we're now able to do hip and knee replacements in younger patients if there are good indications. Hip pain can be aggravated by many types of activities. Supportive shoe wear can make you more comfortable walking around and participating in the activities that you need to participate in. The shoes that you wear are likely not going to contribute to whether or not you develop arthritis in your hip, but I think they can be effective in helping you control the symptoms that are coming from hip arthritis. Physical therapy is a very important tool in both hip and knee replacement. Uh, After a knee replacement, I ask that all of my patients start physical therapy pretty much as soon as possible. And the reason is because they need to get their range of motion back and work on strengthening their quad musculature fairly early. For hip replacements, it's less common that I prescribe physical therapy. In general, walking and letting life kind of be your therapist are all that's required. From time to time, though, patients who were really deconditioned prior to surgery need a little bit of help getting going and strengthening the muscles around the hip, and we will prescribe physical therapy. Usually that looks like strengthening either the muscles in the front or the back of the hip, kind of depending on the approach that we use, and helping you with stretching and range of motion. The hips, knees, and ankles all contribute to the alignment of the entire lower extremity. And it's certainly true that pain or deformity in one joint can cause pain in another joint. There's nothing really that we can do necessarily to stop the process of degeneration in the hip or knee. A lot of that is determined by genetics or previous trauma, but we can control the symptoms of hip and knee arthritis. The things that have been shown to be very effective for controlling the pain that comes from hip and knee arthritis are aerobic activity, physical therapy with aerobic activity, and particularly for the knee, strengthening the quad muscles, anti-inflammatory medications, and intermittent steroid injections. And those things can certainly help calm down the symptoms that come from knee arthritis. Where you have the sort of knock-knee deformity in the knee, this can affect your gait and motion more so than a bow-legged deformity may, which is actually more common to see with knee arthritis. And if that angle in your knees is progressing rapidly, that's actually a pretty good reason to come in and get some x-rays and talk more, because stopping that progression may be in your best interest earlier on than later. And certainly addressing issues in the knee can help with pain that you're having in your hips and vice versa. Well, thanks again for the opportunity to answer some of your questions about hip and knee arthritis. If you're experiencing any of these symptoms or have questions about your hips or knees, it's always worth coming in and visiting and chatting in person. You can schedule online and we can get you in and we can meet personally.